back to student nurse Kevin. For today's video, the topic is going to be urinary calculi, also known as kidney stones. Now this video is mainly targeted at basically everyone. Everyone can get a kidney stone. So if you're a nursing student, this will be a great studying tool for you. But also if you're a human and can get kidney stones, or you have one of these risk factors, this video is especially good for you. Let's get started.
I'm so excited.
So starting out with the risk factors, we have family history. So if you are a close blood relative, like a sibling or your father or mother had a kidney stone or had a history of them, you're more likely to be at risk for them. Another risk factor is dehydration. So if you're not getting enough fluid intake, particularly water, that's going to create an imbalance in your urinary system. And that could lead to more salts than needed in your system, which is going to make your kidneys work harder, which increases the risk of you coming down with a kidney stone. You also have to worry about certain diets, particularly if you have a high salt, protein, or sugar diet. All those diets where you're eating a lot of that is going to put you in increased risk for kidney stones as well. Now, certain supplements and meds. By that, I mean certain medicines and supplements such as vitamin C, or another big one could be your Tums or any type of antacid. Those are made up of calcium carbonate, which can, since most kidney stones are made out of calcium, if you're eating too much of that, it can cause you to contract a kidney stone. Another is obesity. All that extra weight is going to make your kidneys work harder and cause you to come down with a kidney stone. Or digestive diseases and surgery, such as gastric bypass, or if you have Crohn's disease, it's going to affect how your body can absorb certain nutrients, which can put you at an increased risk for kidney stones. And other medical conditions, such as ones dealing with the urinary tract, like chronic UTIs, can also put you at an increased risk for kidney stones as well.
Well, then we're screwed.
The kidneys are like the washing machine of your body. They basically, as blood comes in, they filter out the blood, and the nephrons, which part of them, if you're familiar with pathophysiology and anatomy at all, include the descending loop of Henle and the ascending loop of Henle, where all the filtering takes place, where it pulls out the waste and puts the clean blood back in and sends that waste into the ureters, which becomes urine, into the bladder, out through the body. Kidney stones typically form in the part of the kidney that is known as the renal pelvis. The renal pelvis is where the ureter connects to the kidney. And as those stones pass, if it's one you're just going to have to pass, it's going to have to come all throughout the ureter, down into the bladder, where you eventually void it out. When it comes to kidney stones, you have 4 types. First type is calcium, which about 80% of stones are made up out of. Next up, you have uric acid stones, which account for 5 to 10% of stones. Now, risk factors for uric acid stones include being overweight, diabetes mellitus type 2, chronic diarrhea, gout, and if you have a diet that's exceptionally high in meat and very low in your fruits and veggies, that also puts you at risk for a uric acid kidney stone. Next up, you have struvite stones, which make up for about 10% of stones, and UTIs have been known to be an associated risk factor for those. And lastly, you have cystine stones, which make up less than 1% of all kidney stones. Next up, we have signs and symptoms. So some of the signs and symptoms you have when you have a kidney stone are flank pain, meaning you have pain right here in the lower back, right where your kidneys sit. You can also have some abdominal pain, as that pain can radiate down to the abdominal area. Nausea and vomiting is another symptom of kidney stones, as well as constipation, hematuria, which basically means blood in your urine. You also have difficulty voiding, pain when you void, the urge to void, as well as fever and chills. And in cases of chronic kidney stones, if you don't really get them treated and you just keep on getting them, renal failure. Okay, next up, we got diagnostics. And one of the first things they're going to do when you come into the ER or the clinic is they're going to do a general assessment. Now, in this assessment, they're going to ask you about your pain, the characteristics of the pain, you know, like how long has it been going on? What do you rate it as on a scale of 1 to 10? Where is it located at? And typically with kidney stones, like I said earlier, they can tend to start right here in the lower back in a flank area, but sometimes they can radiate towards the abdomen and even into the groin. And now with men, you have an extra symptom that could happen, and that is pain at the tip of your penis. Now, as far as other diagnostic tests they're going to do is they're going to have a urinalysis. That is when you, I'm sure you're aware of it, you pee into a cup and then they take a look at your urine. With that, what they're looking for is they're going to look at the character. So they're going to look a bit about the color of the urine to see, is it like clear, is it yellow, dark amber yellow, or is it even brownish? Because when you have some blood in your urine, it's going to be this reddish brownish color if there's a lot of blood. They're also going to look to see how frothy it is. Next, they're probably also going to do a litmus test with it, where they'll stick that piece of paper in the urine and take it out and see the pH of your urine. Now, an above normal pH is going to indicate that you possibly have a kidney stone, as well as maybe some sort of infection, maybe a UTI, maybe a bacterial infection or viral. If it's bacterial, they're just going to have to give you some antibiotics. And if it's viral, you're just going to have to let the disease take its course. Another test they like to do is a blood draw. And you may think, what does blood have to do with the urine and a possible kidney stone? That test is more or less to rule out other possible complications you could have. One thing they're looking for is to say, hey, does he have an elevated white blood cell count? Because if you have an elevated white blood cell count, that could indicate an infection, maybe a UTI or even appendicitis. I remember when I had a kidney stone, it was my first one, and I thought I had appendicitis. So I went to the doctor and they said, hey, your white blood cell count is normal, so we've ruled out a kidney or appendicitis. But your urine levels do show signs of kidney stones. Next, if they do think you have a kidney stone, one extra test they could do to confirm or rule out that kidney stone is some sort of scan. Normally, those scans are going to be either an ultrasound or a CT scan. This scan can confirm or rule out if there's a kidney stone, and it'll also give them an idea of how big the kidney stone is and where it's located at and the process of the body getting rid of it. You're out! When it comes to treatment, that's really going to depend on the size and location of the kidney stone. Kidney stones vary in size. They can be as small as a grain of sand, to some have been seen to be even as large as a golf ball. Now, even kidney stones as small as 1 millimeter can be extremely painful. Now, the decision is if it's small enough, usually 3 millimeters or less, that's usually the cutoff area where the doctor will say, well, let's let it pass. And if they do decide to let it pass on its own, they're going to give you pain meds, such as Percocet or maybe hydrocodone, or they'll even give you some anti-nausea medicine to help with the nausea that you're going to get. Now, if the stone is too large, they're going to do surgery. Now, we're going to go from the less invasive surgeries to the most invasive surgeries. Starting out, they're going to do a uteroscopy. That's where the surgeon will insert a scope up to your urethra, and then he'll go up to your ureters and the kidney renal pelvis area, where he's going to catch the stone in a basket and remove it. Sometimes, especially with the ones that are on the larger side for that surgery, what they'll do is they'll use a laser to break up the stone, collect the larger pieces, and the ones that are very tiny enough, they may just leave them there to pass on their own and give you some pain meds. Next, we have shockwave lithotripsy. Now with that, they're going to have you lay on a special bed or maybe in a special tub, and they're going to have you sit in some type of special water where they're going to send shock waves through that water in hopes that as it penetrates your body, it's going to cause the stone to break up into tiny pieces and fragments that can pass on their own. Next up, we have a percutaneous nephrolithotomy. Try saying that 5 times fast. With that, what they're going to do is they're typically going to make a tiny incision on your back, and through that incision on your back, they're going to insert a scope and an ultrasound probe, and they're going to use that probe to help break up the kidney stone and collect the pieces. And usually after that, they'll place a stent in place there for a week that they will remove when that week is up. And they'll also usually want to keep you for about a day for observation. Next up is the most invasive surgery, and they hardly do this one, but the stone is way too large or in an area where they can't reach it. They're going to do an open stone surgery, which is the same as percutaneous nephrolithotomy, but it's going to be a much larger incision, and it's much more invasive, and healing time is much longer. Now, when it comes to prevention, just think your ABCs of health. You know, you want to have moderation in your diet, have it nice and balanced, get adequate sleep, get enough fluids and stay hydrated, avoid salty foods, eat your fruits and vegetables, and get exercise. Thanks for watching the video, and don't forget to like and subscribe. Until next time.